people who have psychological changes. That's the term used in the equality legislation and other forms of legislation to describe the world of mental health, although in practice it's not seen often in that way. So there is a disjoint which we might have a discussion about later on, about the world of people who are disabled, in quotes, and those who have mental health difficulties, and where the two sit in terms of policy. Back to policy, Vision for Change was launched in 2016, and I have to say at the time every person who could speak about it said yes, this was a good policy and we should implement it. And the policy itself stated that it should be implemented within a 10-year framework, 2006 to 2016. I remember distinctly all the political parties at the time supported it, all of the professional bodies supported it, all of the voluntary bodies like Shine and everybody else said, yes, this is great, we'll do it. I'll tell you what happened for the first 2 years. It was nothing. Actually, nothing happened. Despite the fact that the minister, and at that time, and it was the minister of the Fianna Fáil Progressive Democrats who brought in the Vision for Change policy, very gung-ho about it and wanted to implement it. They were handed, the policy was handed to the Health Service Executive, who were the lead agency responsible for mental health service provision. And nothing happened until 2008. And the reason nothing happened in hindsight, I think, is because the HSC itself was only formed in 2004. And it was only getting to terms with its own structuring from being 8 or whatever it is, 11 health boards prior to that, to becoming one unified system, which it is now. So nothing happened. The second reason I think nothing happened is it was handed a book, a Vision for Change, and said implement it, and had no particular part in formulating it. So it was just being handed something to do. 2008, 2009, things began to move, and there were small changes made. They began to decrease the number of beds, they began to increase the number of community mental health teams, other changes came into place. The mental health asylums were being closed down because everyone agreed they should be closed down. 2008, 2009, up to 2014, the recession hit the country. Everyone stopped. Everything stopped. Every budget was cut, including mental health. Significant chunks of money were taken off the health service, first of all, and off mental health as well, to try and reconcile the issues of the day, the deficits and so on. And that happened. You know, you like it or not, that happened. Curiously enough, in mental health, the government of the day, which was the Fianna Fáil Progressive Democrat government first, then the Fianna Fáil Green Party government, and then the Fine Gael Labour Party government, all promoted Vision for Change and all continued to fund it and to provide developmental funding, new monies every year. It was roughly around 25, 26 million euro per annum every year, up to about 2014 or 15. And that money was meant to be for new development. The plan was, stop doing what you're doing, take this new money and do something new with it. And that was fantastic, and it is actually a fantastic idea. It's a way of manipulating change by saying to you, we're going to give you money if you do something new with it. We're not going to give you money to keep the old system going. The problem was twofold. One, the HSC, because it is the accounting officer, it actually is its own accounting officer. In other words, they have responsibility legally to make the budget meet. They actually started to use monies that they got from any source to shore up other deficits. So decisions were made, and the accounting officers of the day will tell you that, did say that publicly. We had deficits in older people services, or we had deficits in children's physical care services, or we had deficits in something else. So we took this money that we were given for mental health and we used it to pay the bills in some other area. Very upfront about it. Now, what that actually shows is some sort of thinking about the hierarchy, which is more important. Are older people in nursing homes more important than mental health? Are children in paediatric services more important than mental health? I'm not saying they are, there are not, but I'm saying that decision-making process was made, and the result was, of course, that mental health didn't get money to develop what it developed. The second big issue was that the government couldn't do anything about it. As I said, the government could make the vote and pass the money in the legislation, in the national budget. It then handed the money over to the HSE, and the CEO of the HSE was the accounting officer. He could decide legitimately and legally, this is how I want to spend this money, and no minister could object or change it, which is one of the weaknesses of the HSE in terms of its disconnect between the policymakers and the people who allocate the monies and the actual service provider. The minister literally has no power unless he changes some of the laws around telling the HSE. He can certainly put pressure on them. He can hold money back, but he can hold money back next year. Can't do anything about the money they have now because he's handed it over already. So there are issues there around the system and how the system actually manages mental health services. And if you look at the bigger healthcare crisis, some of it is because of that. It's because of the way the HSE has to provide its services because, one, it says it doesn't have enough money, two, it has demands it can't compete with, and three, it has supply side problem in terms of getting staff. And all of those factors make it do what it has to do. And that's why you end up with waiting lists and all sorts of other issues that you hear about. Now, some of them are not about money, but they're partly about our organisation. Okay, so now we're up to 2016. Since then, things have relaxed a little bit. 2015, there's now been more money invested in mental health. I'm glad to say it has been directed into mental health care services, and we've seen a major shift out of the old institutional model to community-based services. The problems now, from my perspective, are twofold. One, we still don't have enough people working in mental health community services. There's a shortage of occupational therapists, particularly, a shortage of psychologists, a shortage of social workers and other ancillary supports, which are necessary for this biopsychosocial model we're trying to provide. The result is that you have nurses and doctors, and even now there's become critical shortage around nurses and doctors in certain parts of the country, as you know. And what you have is, I always use the analogy of football teams. You have football teams out there with 7 or 8 players instead of 11. And that's very difficult to win a game when you're short on players on a team. As far as I know, there are still no completely populated mental health teams in the communities. They're all short on something or somebody somewhere. And that's a problem of supply and a problem of demand and a problem of organisation. And the other big issue, which is related to that problem, is that we still rely on the medical model. So you will, of course, get good attention from psychiatry and from nursing. You may get good support from psychology. You may get good support from occupational therapy, or you may get good support from other therapists. You may be waiting a long time. Psychology waiting lists are 9 to 12 months, I believe, unless it's a very urgent case, which is 4 to 6 weeks. Now, even in mental health urgency, 4 to 6 weeks is a long time. So there are huge issues there about access to the type of service people want and or need, and there's huge issues about supplying the right people at the right place. And that's why in Ireland now you have basically a community mental health service which is across the 26 counties, but the quality and quantity of those services varies enormously from county to county, from town to town, literally from one community area to the next. Huge inconsistency because of that, and there are other reasons to do with budgeting and so on as well. The good news is that all governments have supported mental health change, the present government included. There's been 5 ministers for mental health, and they've come from, off the top of my head, from Progressive Democrats, Fianna Fáil, Fine Gael and Labour. And they have all worked hugely to try and push that shift in terms of from the old to the new. Their weakness is about the control of money. They can only control it up to the point of delivering it, but after that there's very little say in how it's actually spent. But to be fair to all governments, no matter who they are, they have prioritised mental health. and there has been a political will. I think the problems we have now are the ability to enforce that political will from government's point of view, and the ability of the health service executive, which is providing 95% of all mental health services, to deliver what's required in the context of their huge structure they have. The HSE is a very complex, massive organisation. Everyone recognises it needs to change, and there's a plan to change it, but it's essentially trying to grapple with providing a local policy in local regions through an enormous machine that's, you know, providing massive general hospitals and other types of services as well. So there's definitely a need for organisational change and structural change. There's a need for shifting something around the political ability, the will of the political will, and making that stronger, so that government can have much more of a say in how things happen and what happens. I think that's about enough. I'm probably going on far too long. So, and I've talked very much around policy and service delivery. Shine, for a small part, tries to again focus on the person and the individual and support the individual and the person or the family in terms of how they can negotiate their way through this incredibly complex area. The things we hear about are things like accessing mental health care services, having to go to A&E, only being given medication, having to wait for psychology or social worker, my child not being able to get the type of intervention he or she needs at a particular time. All the usual, not usual, all the practical, everyday experiences that families deal with in terms of health and education, they're still alive and well in mental health as well. Thankfully, we've gone from the days when, if you're very unwell, you spent most of your life in custody in a mental health institution. What you have now is that you remain in your community and you're meant to get the type of support you require from time to time to make your life a reasonable life and a good quality of life. That support is there sometimes it's not there. In various parts of the country, it's better than other parts of the country. So it's about consistency, quality, and appropriateness and timeliness of the type of support that people want. So that's where we are, and it is, I think, important now that you hear a more personalised view of Irish experiences and so on, and I can't share that, but our next speaker can. So thank you very much for your time and your attention. We can have a chat later on.